Hi, my name is Savannah. I'm a nurse practitioner student. Thank you for taking the time to do this interview with me. If you could just tell
Absolutely.
me a little bit about yourself.
Okay, so my name is Callie. I am a family nurse practitioner. I graduated from Youngstown State in 2019 with my bachelor's, and then I went to work in labor and delivery at St. E's in Boardman. And then after that, I decided to go back for my master's. I went back for family practice, so that's what my degree is in. However, I do specialize in obstetrics and gynecology, so I work at an OB office now.
And what drove you to go work at an OB office as an FNP?
So it's actually, I mean, I love labor and delivery. I love women's health. So I think that, the opportunity and the fact that I was able to stay in my specialty that I came out of school into was great. So I kind of just continued on with my career.
Awesome. And so this next question is, you described it a little bit, but it's just to describe your advanced practice registered nurse position and your specialty, which you kind of explained. But if you could just give us like maybe a day to day of like what you do.
Yeah, so I do work in an office. So, you kind of go in, you see what patients you have for the day. There's a lot of variety. Sometimes we have OB patients, sometimes we have GYN patients. We do well woman exams. We also do problem visits. So every day is a little bit different. However, you are seeing the female population. We see people all throughout their pregnancies and all kinds of complications throughout the lifespan in terms of gynecology as well.
And so, what do you see the advanced practice registered nurses' influences on today's healthcare system, especially in OB and GYN?
So particularly in this area, I feel like it's very relatable, but I mean, in a lot of other areas as well, there are a lack of providers. There's a lack of medical doctors, especially in this area with OB. So that advanced practice registered nurses are able to come in and kind of help with the patient loads that the doctors are seeing. Everybody, we're kind of providing accessibility to healthcare, making it easier for patients to be seen.
Great. And then, what are some barriers that you feel like the advanced practice registered nurses face?
So in the state of Ohio, you do have to work under a medical doctor. So I feel like that can be a barrier, especially when it comes to providing patient care. Again, you have to work with a doctor, so that can make things a little bit more difficult. And I think there's also a lack of kind of support for nurse practitioners sometimes. So you just have to find a good provider who's willing to work with you and, understands that you're very beneficial to the practice.
Yeah, right. And what are some changes that you'd like to see for advanced practice registered nurses?
I hope that it's not really for advanced practice nurses, but I hope that RNs are able to kind of get some more access to schooling and understand that they could still provide bedside care in the medical field and still have an advanced practice degree as well.
Okay, great. Well, Kelly, I think that's all the questions I have for you. Thank you so much for taking your time.
Awesome, absolutely.